Okay, great. I think we have quite a few people, so I'm going to get started. I want to thank everyone for attending our presentation today. Thank you for taking the time out of your busy schedules. My name is Mandy Freer, and I'm a staff technologist for diagnostic imaging with Accreditation Canada. Today, we are going to present information on our ISO 15189 Plus diagnostic imaging program with Accreditation Canada Diagnostics. We also have two panelists here today that will be speaking later, Kate Smith and Nicole Jenkins, who will answer some of your questions and share their experiences working in diagnostic imaging accredited facilities. I would also like to introduce you to our leadership team here at Accreditation Canada Diagnostics. You may hear from some of them later in the webinar as we answer your questions. So we have Mayank Khanna, who is the director here at AC Diagnostics, Jennifer Roberts, who is our senior program manager, Terry Malloy, who's the manager of the ISO Plus programs, which include both lab and diagnostic imaging, and then of course myself. I would like to go forward by first acknowledging the significance of the land on which we stand. I am presenting to you today from, and I reside in the city of Toronto, and I acknowledge that I live and work on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is part of the Dish with One Spoon territory, an agreement between Indigenous nations to share and protect the land in peace. I am grateful for the opportunity to work and live on this land and commit to the ongoing work of reconciliation. At Accreditation Canada, we recognize the historical injustices faced by Indigenous cultures and communities across Canada. As we move forward, especially during this season of renewal, we are committed to the journey of healing, reconciliation, and decolonization. So a few housekeeping items here. I would like to mention that we have both a chat and Q&A function. The chat can be used to share any insights with other attendees, and this will be visible to all participants. And then the Q&A function can be used to ask your questions. Those questions will only be visible to the presenters. I would also like to mention that this session is being recorded. So anyone who would like to see it in the future, or for those who cannot attend, it will be there for your viewing. To begin, I would like to share with you our mission here at Accreditation Canada. And our mission is to empower and enable people around the world to continuously improve quality of care. And before we delve into the details of our DI accreditation program, I would like to share how AC Diagnostics fits into Accreditation Canada. It is important to note that AC Diagnostics operates as a business unit of Accreditation Canada, and Accreditation Canada delivers a wide range of high-impact assessment programs for both health and social service organizations powered by HSO, which stands for Health Standards Organization. Accreditation Canada works with more than 900 expert peer surveyors with extensive healthcare and social services experience and are trained in Accreditation Canada's customized continuous assessment program. Accreditation Canada Diagnostics, which you will also hear me refer to as AC Diagnostics, is a program that assesses the quality and competence of healthcare facilities performing medical testing, specimen collection, and diagnostic imaging. It provides accreditation based on the ISO 15189 standard for medical laboratories and for diagnostic imaging. In addition, the echocardiography quality improvement program also falls under AC Diagnostics and provides accreditation to echo labs within Ontario. The intentions for this presentation are to provide background on our ISO 15189 Plus accreditation program for diagnostic imaging, to show how this program can support strategic hospital goals, to explain the benefits of a quality management system, also called a QMS, to demonstrate how a QMS can improve your service, and to share experiences from our invited guests working in accredited facilities. A little bit more about Accreditation Canada Diagnostic. We are part of the International Laboratory Accreditation Cooperation, otherwise known as ILAC, Mutual Recognition Arrangement. We are internationally recognized as competent to evaluate laboratories and diagnostic imaging facilities. We ourselves are assessed based on the ISO 17011 standard, and we conduct our assessments based on the ISO 15189 standard, and the program you are learning about today is known as ISO 15189 Plus. We also include DI-specific content, and one example would be the CSA Z314 document, which is about the decontamination of reusable medical devices. Now, for those of you who are not aware, I also wanted to share more about the meaning of ISO. So ISO is actually not an acronym. It's derived from the Greek word isos, meaning equal or like. ISO is an independent, non-governmental international organization with a membership of 165 national standards bodies. They develop voluntary and consensus-based standards, and these can then be adopted by countries as national standards. Our diagnostic imaging accreditation program mirrored the medical laboratory program in 2017. So the medical lab program, as I mentioned before, is also based on ISO 15189, and it is mandated in Ontario. It has existed now for about 25 years. Currently in Ontario, the DI accreditation program is voluntary, but in Newfoundland and Labrador, their government has mandated accreditation for all of their DI facilities, which is actually 42 facilities. Our DI assessors are comprised of technical experts and clinical management leaders working in the field. And you can see on this slide the following modalities that we cover as part of our program. So we basically have every DI modality there, and we also include teleradiology and point of care. Our program requirements are based primarily on ISO 15189, but are supplemented extensively with up-to-date technical detail specific to each diagnostic imaging modality, and also the following. So I'm sure you recognize some of the following acts, which include the Medical Radiation and Imaging Technology Act, the Regulated Health Professions Act, the Healing Arts Radiation Protection Act, the Nuclear Safety and Control Act, as well as Safety Code 35 and 36. What distinguishes our program? Our peer assessors are pre-certified through a comprehensive assessor training program. This consists of online self-study, 1 day of classroom training, a formal examination, and annual refreshers to maintain certification. All accreditation assessment teams are accompanied on site by a staff technologist, so for example, myself, who is a full-time AC employee. This ensures consistency in the assessment process, that impartiality is maintained, and that confidentiality is observed. Our assessment teams contain experts in all areas covered under the scope of accreditation, and a typical assessment may include as many as 6 technical assessors, depending on the scope being assessed. Our assessments are designed to cover both single-site and multi-site organizations, and our requirements include a large amount of guidance information and modality-specific application. Participation in the ISO 15189 Plus DI accreditation program can exempt your department from the hospital-wide accreditation program, which is called QMentum. So on this slide, you'll see a snapshot of our accreditation cycle. So I will touch on this briefly, and on the next slide, I will break it down a little bit more. So you can see we have a 4-year cycle here, which begins with an application for accreditation. The client would then do a self-assessment, which would then be followed by a full on-site assessment visit. At the 2-year mark, we would conduct a mid-cycle surveillance visit. And then finally, at the 4-year mark, we would conduct another full visit. So breaking that cycle down a little bit further, so within 1 year after enrollment, our clients would submit a self-assessment. So what is a self-assessment? You would take our requirements and assess yourselves against them. These are the same requirements that would be used on your assessment visit, and then you would submit your findings to us for review. Once the self-assessment is submitted, the on-site assessment visit would occur at a mutually agreed upon date about 4 months later. After the assessment, the client is issued a report detailing any nonconformances, and within 90 days, the client will submit corrective action plans to address these nonconformances. Within about 5 months, so 3 months for the client to submit a successful corrective action plan, and 2 months for us to review, the client would receive their accreditation certificate. 2 years after the initial assessment visit, a mid-cycle surveillance visit is conducted. So in a mid-cycle visit, the AC Diagnostics team will review select requirements along with any previous nonconformances. And by year 4, another full assessment visit is conducted. So thereafter, full assessment and mid-cycle assessment visits would alternate every 2 years. What are some benefits of our program? So your department would definitely see a reduction in risk, assurance of technical competence, and increase in staff confidence and professional development. You would be implementing an ISO quality management system. And enrollment in the program demonstrates a commitment to quality and accountability. And you would also see cultivation of fresh ideas. And very importantly for our patients, our program provides quality assurance, standardization and consistency in care, and elevates confidence in the healthcare system. So I'm going to pivot a little bit here and talk about some of today's healthcare challenges. So I'm sure we all can see that there are increasing complex health needs of changing communities. There are growing social inequities, increasing staff shortages and staff burnout, and a disconnected system that is challenging to navigate. Of course, these are some, but not all challenges. So how can we help support your health systems and your hospital strategy? Implementing the Accreditation Canada ISO 15189 plus program requirements, most notably a QMS, will support quality improvement across the healthcare system. It will help you to embed leading practices and standardization. It will help to ensure each patient receives the highest quality of care through a highly reliable practice. It will help you to adapt a more collaborative and integrated approach with the system, and it will help to implement meaningful engagement at all levels. So what is the value of quality? There are multiple points in diagnostic imaging processes where errors could occur. And I'm sure all of you have seen some of these at some point in your career. These can include improperly ordered examinations, incorrectly acquired images, equipment failures, lost or delayed reports, and/or erroneous interpretations. All of these can adversely affect patient care and result in unbudgeted organizational costs. Some could even advance to litigation. And we understand that perfect processes are not always attainable. But studies have shown that we can improve quality without increasing cost, and we can reduce cost by improving quality, mainly by reducing variation. And in fact, one of the many definitions of quality is lack of variation. The following slides will help demonstrate how we can improve quality by implementing a QMS. With a quality management system, all processes are documented and standardized. Processes are controlled in a systematic and transparent manner, and staff members will know exactly how things are done, who is responsible, and where to find information. This information can easily be shared with the users of the service for improved communication, to clearly define expectations, and to improve credibility. It is important to know that in order to refine processes, you have to define them first. And you can see the quote here on this slide by W. Edwards Deming, who is one of the founders of quality management. And it says that if you can't describe what you are doing as a process, then you don't know what you are doing. So this is just some food for thought and something to think about as you go forward. Our program will also lead to risk reduction. So the identification and mitigation of risk is a major component of a quality management system. In your departments, you will definitely see an increased awareness of risk. You will focus efforts on issues that matter most. You will create a culture of prevention and thereby increase success. Part of our requirements also includes training and competency assessment. Training and competency assessment is required for all personnel performing DI procedures. And this is specific to the workplace because it should never be assumed that a new individual does not require training. Competency assessment is required to verify that the initial training was effective, and competency assessment is repeated periodically, with competency assessments chosen based on risk. Measurement is another strong component of our program. A QMS includes a set of tools to measure and self-correct continuously. These tools are quality indicators, investigation of nonconformities, internal and external audits, and management review. Test utilization. I'm sure this is one of the many things that we can all resonate with. The program includes specific requirements to address the correct utilization of DI services. Tools will be implemented to monitor and react to opportunities for improvement. This will involve collaboration with various healthcare providers, and this also includes enhanced consideration for at-risk populations. Another benefit we see from our program is engaged and empowered staff. How does this happen, you might ask? Meaningful engagement by all levels of staff is a foundational concept in a QMS. It is team-based and considers information, input, and insights at all levels. A surprising result is increased staff confidence, morale, and professional development. Staff will enjoy learning new skills and responsibilities. And finally, AC Diagnostics has also incorporated requirements related to people-centered care. Now, this slide demonstrates how our program promotes sustainability. By participating in this program and having regular assessment visits from us, clients doing their own internal audits, continuous improvement is inevitable. The processes and the tools used to measure them are well defined and designed for continual improvement. Annual internal audits and visits from accreditation teams will keep up the momentum. Again, you will see a snapshot here of our accreditation cycle. This shows how we work together with our clients to keep up the momentum of continuous improvement. Public trust. How do we assure public trust? The public has trust in the healthcare system when they go somewhere for care. Patients are savvy customers and expect the same level of delivery in healthcare as in aviation, as in automotive and hospitality. Patients expect the same level of care no matter where they go. Through accreditation, we see standardization across health systems, and through standardization, we promote equality of care no matter where a patient goes. Quality management system thinking really is the gold standard. The concepts within the management requirements of ISO 15189 are by no means unique to diagnostic testing services. The concepts are derived from ISO 9001, a document that sets out the criteria for a quality management system. It is the internationally recognized gold standard for quality delivery of any service. There are over 1 million companies and organizations in over 170 countries certified to ISO 9001. What could your new environment look like? Processes are well thought out and documented, and responsibilities between individuals and departments are understood. These processes are created with risk in mind. Risks are documented and high-risk elements are mitigated through process design. These processes are supported with step-by-step procedures, policies, and regular monitoring. Everything is shared. All staff have the current source of truth. Training and competency assessment to the process are implemented. The processes are monitored using the following tools: occurrence management, including root cause analysis and corrective actions, quality indicator monitoring, internal audits, and management review. So in summary, implementing the Accreditation Canada ISO 15189 Plus program requirements, mainly a QMS, will support hospital strategic goals. It will help you to embed leading practices and standardization. It will help to ensure each patient receives the highest quality of care through a highly reliable practice. It will help to adapt a more collaborative and integrated approach with the system, and it will help to implement meaningful engagement at all levels. The ISO 15189 Plus program builds on your foundation to provide additional third-party assurance in the technical competence of all DI examinations and provides formal recognition that you are meeting the highest standard possible. So before I hand it over to our panelists, I do want to point out that AC Diagnostics also offers education programs to help sites learn some of these aforementioned concepts and also to prepare for accreditation. So you can also see on some of our backgrounds that we have a QR code, and that QR code will link to our education page. And more specifically, we do have an upcoming course, which is particularly for preparing for diagnostics accreditation. So this course is actually coming up in August of 2025. So you can feel free to scan that QR code, or you can reach out to any of our team here if you have any questions. So again, I would like to thank you all for attending this presentation. I would like to thank you for taking the time out of your busy schedules. So my name is Mandy Freer, and my email is there if you need to reach out to me for any questions or comments. I'm happy to help out. And before I get into some questions for the panelists, I'd also like to thank our communications team, Tammy and Brittany, who are on the call, for helping put this webinar together and helping us make this webinar possible. And without further ado, I would like to introduce Kate Smith, who's the Director of Diagnostic and Therapeutic Services at Aurelia Soldiers Memorial Hospital here in Ontario, and Nicole Jenkins, who's the Director of Medical Imaging of the Eastern Urban Zone in Newfoundland, and she's also the Provincial Quality Manager for Newfoundland Health Services. So both of these panelists have graciously agreed to join us today to answer some questions and share some of their experiences. We are also monitoring the Q&A, and we will try to get to as many questions as possible. If we do not get to your questions today, we will be sending out a Q&A document to all of the participants after the webinar is over to answer the remaining questions. Okay, so I am going to stop sharing here, and I am going to go ahead and start off with a question for Nicole. Okay, so Nicole, can you speak about the benefits that the program has had for your departments, your hospitals, your staff, and your patients?
Sure thing. Thanks, Mandy. Hi, everybody. It's nice to be here, first of all, and I certainly appreciate the opportunity of being able to come and speak about our experience in Newfoundland and Labrador on going through an accreditation diagnostic process. Just quickly, without taking up too much time, maybe to give you kind of a little bit of background about where, how we got into this. We became a provincial health authority in 2023, and we had to go undergo a provincial medical imaging accreditation process. So our journey with AC Diagnostics started in the fall of 2023, and we did our first survey in July-ish of 2024, and we had our first site visits in from September to December of 2024. And we completed all of our action items and we submitted them, and we're waiting for one more area now in Newfoundland to say that we've met all of our AC Diagnostics requirements. So it's a pretty exciting time, but a pretty busy year over the last year in particular. So if I was to tell you the number one benefit of going through a provincial accreditation, but not just a provincial accreditation, but an accreditation with AC Diagnostics as opposed to our other hospital accreditation, it would be that right at the frontline level, at the grassroots level, you incorporate your frontline staff into accreditation because you have to make it a part of their normal work. And that is something that, was a massive complaint by our staff for many years. It's no trouble till accreditation is here. It's once every 4 years. We're starting seeing the management team out now. They're talking about it, 6 months before. And, the staff felt very disconnected with accreditation. And I think if you're a manager here on the call, you probably can echo what that might feel like, or some of those comments that staff don't really understand what it is, or staff say they don't really care what it is. They don't see where it fits into their normal working day to day with patients. So what it and I don't want to say force, but what it really did for us over this last year was we had to incorporate it into their work life. So it's not something that becomes, you do on the side. It's every day. Now we have to think about, our standards, are we meeting them? Are we learning from them? The transparency, for all these things. And we give our staff time to be a part of accreditation, because that is the only true way that you can incorporate it and see the change, right? That you want to see, from this program. So it really allowed us to do that because you recognize that you can't do it as a management team, as opposed to some of the other accreditation type models. So that incorporation on the ground is a massive benefit. And, it really allowed us to have and really start developing the consistency and the standardization of our practices. And it really allowed the staff to understand why that was important, and to understand what the standards even are and how it applied to their work. This program is very focused on medical imaging, and it looks at the nuances of our programs, unlike other accreditation models, which are much more broad, and you kind of have to find out how it applies, like to your different departments. But it definitely was a benefit to be able to apply that directly to MR, directly to nuclear medicine, to all those areas, and the staff really saw a benefit in that. So that will be what I would say is the biggest benefit so far that we've seen.
Awesome. Thank you so much, Nicole. So I'm going to move on over to Kate. Kate, can you speak about the benefits of implementing a quality management system?
Yeah, thanks, Mindy. And hello to everyone out there. I can't see who's here, so I'm sure there's some familiar faces. I'll just give a little bit about our journey. We have been through the full cycle of accreditation. So we started in 2019 and became accredited just before the pandemic. And that was such an opportunity to see the quality management system in action. Once the pandemic happened and things were changing every day, we were able to just be agile and respond to the needs and the changing and getting that communication out to our teams. So I was very grateful at that point. The other thing with the quality management system, it does embed continuous quality improvements into your everyday practices. And so you're proactively addressing things or reactively addressing them before it's a really big problem, because they're recognized as part of that data review that we do at our monthly DI quality and leadership meeting. So we do have a separate committee that we work on quality with. I think Mandy also spoke to this, the professional development for our team. Our DI team are now quality experts, and we actually support other areas in the hospital using risk assessments or addressing some of the challenges that people aren't able to see because they don't have that system. So it's helping to embed systems. So we're undergoing a lot of change in our organization right now, and the DI team are well educated and well able to support. I would say maybe an unintended consequence, but intended is utilizing risk assessment to move things forward and having the regulatory requirement. Some of the things that need to be addressed are now covered under those regulatory requirements, and it gives a little bit more weight behind it when you're looking to go through this accreditation process. It'll help you move some of long-standing challenges across different cross functions. So I think we use, I think I mentioned this, but we use risk assessment a lot, and we use it in every area, including whenever we're doing something new or our data shows us that we have a risk trending, then we go in and we look at it and break it down piece by piece. So we would not have had the skill set to do that before undergoing this process. And then the internal auditing is really helpful to make sure that things have stuck. So if we see trending, then we'll do a mini internal audit and just look at a specific area where we're seeing trending in our quality data. And that's part of that system where we act before it becomes a bigger issue. And I think there's probably, I could go on for longer, but I'll save some time. There's lots to talk about today. So if there's any questions, please don't hesitate to reach out.
Thank you so much, Kate. I think both you and Nicole talked about, the opportunity to get a lot of staff involved. And I think that's one of the great things I've seen from this program. So I'm going to move back to Nicole. Nicole, can you speak about the benefits this program has provided to your provincial healthcare system?
No, and I'm glad you asked that because, again, just as a little background, pre-2023, Newfoundland had 4 separate health authorities, and we merged into one, and undergoing, a provincial accreditation, like this, it really allowed us to become unsiloed. When you join, you bring along a lot of your existing, preconceived ideas and ways that we always did it. And, nobody kind of understands what we deal with here versus there. And, so it allowed us to break that down instantly. It really changed the management team's understanding of accreditation. Excuse me, our previous models in our health authorities, we always had, a dedicated quality person who always took the lead with all accreditation, kind of reached out to the managers to work with them and to get work done. But when we tackled this, we tackled it initially as a management team and bringing in all the operational managers and directors at the time, to give everybody a full kind of education, awareness, and understanding of what accreditation is and what, the work was going to be involved to kind of take this on. So breaking down of silos was a big one. The second thing is in Newfoundland, we do have 42 sites. And we categorize our sites. We have one tertiary healthcare facility. That's our big center in St. John's. And we have 13, we call them category A facilities, which are multi-modality centers. And then we have our category B sites, which are rural, and they usually, all of them, in fact, the rural sites are only X-ray. So normally when we did accreditation, we really focused, of course, on our big cities and those big multimodality hospitals. And, accreditation standards filtered out to the category B sites. And, if you implemented and developed something in the city, it just automatically became a thing that you did in a rural site. But this changed the way that we looked at our rural services. And I'm sure anybody who has urban and rural sites, they can tell you that you can't tar everybody with the same brush because, the rural sites they function differently. I mean, the X-ray standards, of course, are applicable, but the things that you look at with risk and continuous improvement and even quality indicators or key performance indicators, don't work the same for those smaller sites. So it really allowed us to develop things differently for the rural sites, which engaged the staff in the rural sites, and it really targeted things differently to them. So that was a huge benefit. But yeah, I would definitely say, our ability to instantly kind of realize that we were all on the same team and that, we all had to work together to meet standards, and the support that we all gave each other, for, one site might have had something developed that we could easily share and implement in other sites. Like it was, a great benefit for sure.
Thanks, Nicole. And I think you mentioned about your rural sites. So some of the rural sites maybe just had X-ray or X-ray and ultrasound. And I believe I saw a question in the chat about accreditation for smaller sites. So I think you highlighted, how it really benefits those smaller sites, even if they're only one or two modalities. Yeah.
Yeah.
That's wonderful. So I will move on to Kate. And Kate, can you speak about improvements in safety?
Yeah, I can. Thanks, Mandy. I think the two things is that system being able to identify issues before or immediately when they've happened. I think the biggest thing that we implemented was quality auditing. So auditing and competency, and then actually record keeping. And so being able to manage that the change that we've put in place is actually sticking and improving quality. I would say one of the biggest areas that we improved quality was in our inventory management and control piece. We had sort of a high level, yeah, we got it, we counted it, and we put it on the shelf. And now we have a very robust process for managing equipment, consumables, and ensuring that we actually have fully sort of non-expired things on the shelf. And also we just went through a recall with our pick lines, and it was a piece of cake. We knew exactly who had them. We knew which ones we had in stock, who we used on others, and we're able to remove them quickly and also contact the patient. So prior to that, we did not have a robust inventory management and control process. The other thing that I think really drove quality, and I like to refer to the IS&P hierarchy of controls, but we put force functions in wherever we could into our health information system to make sure that we were getting accurate information from our orders. And that was a big practice change for the way we receive orders. And we did have to do some improvement work there. We continually monitor that. And I think the quality, again, it's that having that backup when you have to have hard conversations. An example is point of care testing or verbal orders that everybody wants to do, but nobody wants to circle back and sign off on. So when we have these stringent requirements, we put the processes in place to make sure that they're successful.
That's wonderful. So I think it sounds like, this has helped you to be proactively prepared, and then also you have a backup for kind of anything you need to do.
Yeah.
That's great. And then Kate, I wanted to ask I think you maybe spoke on this earlier, but what prompted your team to enroll in the ISO program? And then what factors played a role in the decision-making process?
Yeah, there's a couple of factors. I was a new manager in 2018, and my background is mammography and quality management through the Regional Cancer Program. So I was well versed in quality oversight, and we didn't really have anything like that for the other modalities. And as you're all aware, there's risk everywhere in diagnostic imaging. So I was looking for something to roll out across the entire department. The second piece of that was that every document was out of date. So it was a good time to, it either didn't exist or it was expired. And so it was a really good time to just start fresh. And the document management system was not super functional. So that took us down a little bit different path than maybe another organization, but we ended up implementing our own document management system shared with the lab to make sure that we were able to comply. Yeah, I think that's it.
That's great. And then, so going a little bit forward with that, how did you go about preparing for your accreditation assessment? And then are there any key points from that you would like to share?
Yeah, thanks. And shout out Amanda. I saw your note in the chat. So it's a roller coaster. You're like, this is so exciting. This is a great program. We're going to be great. And then the flip side of that is, oh my God, what have we done? When you start lifting up the rocks, there's work everywhere. So it was a challenge, but that work had to be done, and we wanted to do it in a systematic way. I think for me personally, the best way to get my head around it was the blueprint course. So that's very helpful, the AC Diagnostics blueprint for managers. The second thing was building out that quality manual as a framework to understand the way the system all works. So your quality manual will help keep you going in the right direction. Simplifying and standardizing your documents. You'll be tempted to overcomplicate it. We went through the process, and then in our mid-cycle, because we had learned so much more, it was like, no, we can combine these documents. We don't need this document anymore because we have something else. So your skill set will improve as you proceed through the cycle, the auditing cycle. I would say quality champions in each modality. For us, it was the charges, and having those people embedded. To Nicole's point, everybody's involved in it, but you have your champions when it gets challenging to try and implement things. You have champions out and you're all working together as a team. Another thing that I would recommend doing, I didn't do, is bringing in your stakeholders early in the process. So MDRD, facilities, procurement, having them as part of this implementation will really save some maybe background work in the future if you run across something that actually doesn't comply and it's in another department and they have no idea what you're talking about. So it's really important to bring those stakeholders in, ask for representation. And I think my last point is this, we're all probably high achievers, and you're not going to get perfect, and prepare the team for that. There's always something that can be improved. Even though we've been through, we still find things. We either find them in our internal auditing, or when AC Diagnostics comes on site, and it's a learning opportunity and a growth opportunity.
For sure. I really like that. And I always say that we can always get better in anything we do. And I think, Kate, that you actually answered my next question. So I was going to ask if you had used any tools, resources, or education from AC Diagnostics. And I know you did mention that you did take one of the courses before you enrolled in the program.
Yeah, actually, and if I can comment, there's another, and I might be getting into future questions, but We sent our charges. We didn't send them actually. We brought AC Diagnostics to us and did the education on site. So that helped us with costs, and we partnered with the lab or even other hospitals that are close by. If you want to bring them in and you have a room big enough, you can really benefit from that. So getting your team involved in some of the courses where appropriate is great as well.
That's wonderful. Thank you so much. So I'm going to move on to Nicole. Nicole, can you tell us about some key takeaways or one or two big learnings that you were able to get from the program?
Sure. So for me, you know, the biggest thing is, and I, again, I can't speak to how everybody approaches accreditation, but, you know, using AC Diagnostics and these standards and what it means for, you know, staff involvement, staff engagement, and the integration of staff now in all these processes. It's not just about compliance. It's not just about ticking a box to say, yep, we meet that. Yep, I wrote that policy that covers this standard. Yep, I put this in place that covers it. I can see it, and I mean, I'm very early on into our process, but I can really see how it's going to change the culture, the mindset of quality improvement and continuous learning, and you know, the identification of risks, and you know, all of those things. I can really see how that is it's going to play out for our staff, and you know, I wish everybody, like I was a frontline tech. I worked in MR and X-ray for many years, and I made the leap into quality management. And you know, as a frontline MRT, you don't think about quality, you know, obviously, the same way. And you know, it was a real eye opener for me. And I, you know, once you get into it and you learn about it, you know, you wish everybody would just do it because it's such, you know what it can mean once you put these things in place. So I can already start seeing questions from my staff like, you know, Nicole, I know you brought this up during accreditation, but if we do this, is that going to impact anything? Like it's that change that you're starting to see and that I think will grow. And I hope, Kate, you know, I know you've been at this since 2019. I hope, you know, you can echo that you've started to see those things because that's what I'd love to really get out of it. And to Kate's point, she brought up a really good point that I don't think you realize as a program how much other programs are invested and work for you and how much you have to rely on those programs. So, you know, from stores and purchasing and IT and, you know, infrastructure and security and all those things, you know, they write a process and a lot of times you're not a part of those process. They write and it applies to you. But this really allows you to show how you're connected and work together. Like when they're developing something, okay, we better include medical imaging now because they're going to need this, and you know what, all those things. I don't think we realized how much we needed other programs to be a part of the work that we're doing, because it's not just scanning, it's not just the patient care aspect, it's how our program functions and runs and all those things. So that was a big learning for me, and it was a big learning for all of the other programs as well, because things that we thought we had in place, we relied on purchasing to have policies, and oh, they never. So what did that mean for us? And you know, I really think that was something, a big takeaway. And the next thing to me is about internal auditing. I don't think we realize the importance of you know, teach a man to fish, right? I'm a Newfoundlander, so it's a big thing here. So teach a man to fish. And you know, once you actually get your staff involved in the things that they have to look for, like that grows that momentum and that understanding, and you know, it just becomes a part of normal work. So the internal auditing, it is probably one of the best things that I can say, you know, we've done for that staff kind of involvement. So lots of learnings, but those are my big ones.
That's wonderful. So as we kind of are nearing the end here, I'll just ask a couple last questions. So Nicole, I just ask you how the accreditation has impacted your organization's reputation. And you've probably touched on this through all your questions, but
Mm,
how has it supported your organization's goals?
mm. Yeah. So, I mean, our organizations, our strategic, plans and our mission and our values, is all about quality improvement and sustainability of our service and, the communication with staff and, patient access and equity and all those things, so it perfectly aligns with the strategic plans and goals of our organization. I really do feel that there's a benefit in undergoing an individual type accreditation like AC Diagnostics has, as opposed to an hospital-wide accreditation, because, I saw your comment, Amanda, too, in the chat, and I like Kate, when I first saw the survey, I was like, okay, we're doing it. We're in the rabbit hole now. Like, I don't know how we're going to do this, but you take it one standard at a time. And when you look at it, you realize, you know what, there's a lot of things that and you do well. And then there's things that, you're like, I never even thought about putting that in place. I never even thought about how that would apply. And then you have those aha moments where, you feel glad that you know that now, and you want to work towards that. But it definitely aligns with patient safety, with patient-centered care, which of course is, one of our most strategic priorities. And I think from a patient's perspective, the benefit, I mean, because patients, obviously, they love to see the word full accreditation, right? I don't think they understand what it means fully, but they love to know there's a comfort in that you're fully accredited. But what they see, right at that fundamental patient level is, I now feel confident that the care that I get in St. John's, Newfoundland is the same as what I'm going to get in Gander, Newfoundland. And, there's a trust there that we are upholding these standards and applying them across the board, and that continuity and consistency of care and standardization and continuous improvement, like that will trickle to every aspect of our province. And at the end of the day, that's what I want. I want patients to be able to go anywhere and feel the same, and experience the same care. So, that has definitely been a massive organizational benefit for sure.
For sure. That's great, Nicole. So I'm just going to hand it over to Kate for one last question, then I'm going to transfer over to my colleagues to answer some questions in the Q&A. So Kate, if anyone was seeking accreditation right now, do you have any advice for them?
It seems insurmountable at the beginning, but it's not. Involve your team. Nicole made a great point about the internal audit process. We actually partner our frontline staff to do the auditing, and they're pretty hard on themselves, which is kind of interesting when they audit, but that's how we get everybody involved. I would say that it's important to don't put this all on your manager. It's not a side of the desk process. So designating, for example, our GenRad charge is also a quality assistant, and she gets an extra resource day to work on some of the other things that the manager doesn't always have time for. So I think it's really important that you have that team supporting this process. I'm sure, Nicole, your experience, it can't all be on you for the entire province, and you need to spread the work out and support. And then really, once the heavy lifting at the beginning is done, it's system. It's pretty easy to maintain if you developed your process. Yeah, once it's in place, you're having your quality oversight, and your continuous quality improvement activities will keep you accredited. So yeah, I'll keep it short because I know there's a few minutes or more.
Yeah. And if I could just quickly add to that, Mandy, just to what Kate said, to anybody who's thinking about, kind of going with AC Diagnostics, I think, if you're going to switch from an accreditation, you really need to engage at the beginning why and what, because we kind of didn't do that. We just went right into AC Diagnostics without that overview of, what we were looking for with a new accreditation model. And, to Kate's point, we had, individual quality managers, and they did all the heavy lifting. incorporate this into all your management, make everybody own it, not me, but you know, have everybody own it, because there's learnings there as operations that you don't know if you're not quality. But if I were to do one thing different, it would be in conjunction with that, bring your frontline people in as well. Because we sat down and did surveys and we're like, yeah, we think we're doing this. Yep, we have this in place. But some of the, you know, the staff would be like, yeah, you might have put that in place 10 years ago, but that don't apply right now. So I think, you know, it is a heavy lift up front, but you know, it, once you get that done, it really it'll take on a life of its own, and the staff, you know, will keep the momentum going. And you know, it's just a pride that you feel like, I can't tell you, like knowing that, you know, I'm going to get accreditation with this. It's like, as a program, this is the hardest thing we've ever done. Like, we're going on the news. I'm telling you, we will do whatever we have to do to show, you know, how absolutely beneficial it was for our patients and our staff.
That's great. And I think that, you know, one benefit that I've really found with involving the staff is that, you know, sometimes it's enjoyable for them to be involved and take, you know, take more accountability or take more responsibility. Maybe it gives them a different role. So, you know, this also creates more purpose and more variety in their work as well.
Yeah. And it allowed, like, you guys are medical imaging staff, which is something that we had never had before. So when people come and talk to our staff, they're one of them. They speak a language. It's like a resonating thing. They felt very much, you know, different about this accreditation than what they've ever gone through before. So, you know, I would say that that's another amazing benefit of partnering with AC Diagnostics.
That's so great. And we have 2 minutes, so I'm just going to ask, we have a question in the Q&A that I want to address. Maybe I'll ask Kate, or Nicole can pitch in too. So it's just about, you know, assigning staff, and, you know, with a lot of work that accreditation requires, how are you able to kind of assign their workload, not take them away from patient care? And did you have to prepare any business case? I guess, Nicole, maybe not the business case for your situation, but any thoughts on that?
Yeah, we did a business case up front because we did have to get the FTE to support the quality management system. I would say it was relatively easy because of the risk. So when you point out the risks around it, there's a benefit to implementing this to reduce risk of the organization. So for us, our charges, we asked them to participate in the education, and they are accountable or responsible for their areas. The manager and the director are accountable, but we did ask and build in for resource time and FTE, and that's not part of my permanent budget. So you will have to do the business case up front, but yeah. Once it's embedded and you demonstrate how much risk you're diverting, you can't argue with it. You can do our risk assessment to present business case.
To present your, I was just going to say, that's where we,
I use risk assessment when I'm procuring equipment. And that's part of my capital asks. I've included the risk assessment. That's why we're buying this software or not buying this software. We're not going to do this procedure. So you will use those skills in all of your work going forward.
That's great. Thank you so much. We've hit the 1 o'clock mark. So again, I want to thank Kate and Nicole for sharing your time and your insights. That was so helpful. Thank you again. And then I just want to thank everyone for attending, and please feel free to reach out to us if you have any questions. Again, this is recorded, so you can find this information again, and you will be getting an email from us after the webinar is over with all of the information you need.
Yeah.
Thank you so much, everyone.
Bye, everybody.
Bye-bye.